Everyone, it's Rachel, and today I have a little bit of a different video. So today I'm going to talk about Accutane. Now, I want to do a bunch of disclaimers, but the first thing I'm going to say is that yes, I'm on Accutane. I've been doing it for 2 months and about a week, so about 9 weeks of Accutane. I'm on a 5 month regime. So what I did today was I just threw my hair in this bun because I really want to focus on my skin and let you guys know a little bit more about Accutane if you guys are interested in knowing about that. Now, what I will say is that I'm not recommending Accutane to anyone. I wasn't even going to do videos about Accutane. I haven't really talked a lot about it even since I've been on it. However, I have watched so many YouTube videos about Accutane that have been really important to me in making my decision as well as helping me along with the process. So I decided to make this video because maybe there was someone out there who could learn something from this video, help them make their decision, or help them continue to take the medicine. So I will start by saying before I tried Accutane, I had tried almost everything else, and that is really important. So I had tried Proactive, Skin ID, Clean and Clear, all the topicals that you could think of. And I was really sure that that could work, but when that truly failed me after, I've had acne since I was 15. After that failed me after about 4 years, I decided that I was going to go to the dermatologist and talk about a different option. So I was put on doxycycline, and I had that while I was in Europe, and I was supposed to be on a 3 month track, and at the end of the second month, I've mentioned this in one of my videos, I had a pretty serious reaction in my hands called burning hand syndrome. It was one of the most painful things I've ever experienced. And it was in the summer, and I knew that I wasn't allowed to be exposing myself to the sun, so I decided to stop it, and it really hadn't helped my skin at all after almost the whole cycle. So that was the end of that. And when I got back to the States, I decided that it really was a good time to talk to my dermatologist about Accutane. She had mentioned that if doxycycline wasn't the right path for me, then we could discuss Accutane, but of course you have to try the other antibiotics that are not as harsh before you are allowed to take Accutane. Now, I know a lot of you out there are going to say, Rachel, you don't have any acne, I can't see it. I've watched all of your videos. Well, I was previously using a webcam where you really couldn't see it. And no, I did not have severe acne, but I did have moderate acne that really bothered me, and it would really flare up in the winter, and it would get really bad to a point where I didn't want to go out, and it really messed with my self-esteem. So I decided to go on Accutane after having a lot of discussions with my dermatologist. So I was put on 40 grams of doxycycline. I technically take Clarivis, and so these are the pills. They come in like a big box thing, but I rip it off because, this is all you need. So as you can tell, they have the little warning advisory against getting pregnant. And so getting on Accutane is really hard. There's a lot of hoops you have to jump through. You need to be on 2 forms of birth control. So that was different. And you need to have your blood work done every month to make sure that it's not affecting your liver in a negative way. As well as your cholesterol. There's a lot of different factors that it can affect, so they need to make sure that you're not having serious side effects that are hurting you internally. In addition, so my blood work has been totally fine. After the first month, they said you're doing excellent. Your liver isn't hurting. You're doing great. So we're happy to continue, giving you the medicine. The side effects that I have experienced have been dry lips, which is totally common, and after I discuss it a little bit more, I'm going to go into detail about the products that I'm using to help combat these side effects. I haven't had extremely dry face, but I have been using some of the strongest products available to deter myself from peeling at this point. However, I have developed mild eczema on my arm. I'm going to show you guys. It's just in one area right now. I don't know if you can see it. It's right here. It's just kind of like a little red rash, and it's honestly going away. I'm using a hydrocortisone cream. So that's going away, but I have noticed a big change in my skin. It's been 2 months, and it's still working. I still have small pimples. I did have a cystic acne right here. There's little ones. But the thing that I'm definitely noticing about my new breakouts is that they're very, very small, and that they do not become whiteheads, which is was my biggest issue, was big postulous whiteheads that were, really unattractive, and they took a long time to get rid of. So these little ones are just little tiny pimples, and that's pretty normal. Even post Accutane, you can get little small zits. So how Accutane works, I'm not a doctor, but what I do know is that it dries your skin out. It closes up the sebaceous glands in your body, so you're producing a lot less oil. So basically, what do I want to talk about next? So those are the side effects I've experienced. The mild eczema has been a little bit difficult. The dry lips was really bad at first. I was experiencing where the lips crack back. I don't really remember what that's called, but a lot of people experience that. But once I got onto a really strong lip balm, I have not had a problem. I'll talk about the lip balms I'm using after this. So as I mentioned, it's my 3rd month, and I just wanted to let you guys know that that's what I'm doing right now, so you guys have an idea. And then I will probably make maybe 1 or 2 more videos about it. Also, I experienced some dry spots on my chest. I don't know if you can tell, they're kind of white, which has been frustrating, but it's really not a big deal. I know that my skin is going to look much better after I'm finished with this process, and that gives me a lot of hope. I haven't experienced any problems with depression. That is considered a side effect. It's controversial, but some people say that they do experience depression while they're on the medicine. I have not felt any differences in my mood changes. I feel great, and if anything, it's improving my self-confidence as I'm getting less and less breakouts. So that's that. So now I'm going to talk about some of the products I'm using. So this part is especially if you are on Accutane and you are looking for some products that you might use. So as you guys might know, I work in a cosmetic store, so I have access to a lot of really amazing products. So some of these are a little bit more expensive, but they have really been working really well for me. I don't have them with me, but I'm just going to tell you what they are. The first one is I have been using a couple different lip balms that I found really work well. The first one is sold by Therapy Systems. You can buy it online, and it's called RX for Lips, and it is just like a kind of like traditional jelly-based lip balm, but it's really thick. When I'm wearing it, I can't wear, for example, like a lipstick over it, so I haven't been wearing any lip products except lip balm, which is fine. I'm not a huge lipstick person, but hopefully when I'm done, I'll be able to try some more lipsticks. So that's what I've been using on my lips, in addition to Sugar, which is a product from Fresh. And what I like about Sugar is that there's the original Sugar, which is totally clear, but I've also been using what I use sometimes if my lips aren't really bad, if they're not peeling at the moment, I'll use Sugar Honey, which is a tinted lip balm, which is a really, really pretty color. So I recommend that to anyone on Accutane who is hoping for something that's a little bit more pretty when their lips aren't in a really bad state. I won't use it when they're really cracking, but once I've kind of healed them with the RX for lips, I like to, and they look pretty good, I'll use the Fresh honey sugar honey, I'm not sure exactly what it's called. In terms of for my face, there's a few different products that I've been using. The first one is by Mario Badescu, so it's not expensive, and I think it's $20, maybe $15. It's not expensive. It's called Moisture Magnet SPF 15. It's very important that you have an SPF when you're on Accutane, so that one covers me on that basis. So I use that during the day. So Mario Badescu. Moisture Magnet, and during the night I use one of 2 products. The first is the Perricone Nutrient Mask, which is a very, very hydrating mask, and it says to tissue it off after 10 minutes. I just leave it on all night, and when I wake up, my skin is very soft. It's actually something I've been experiencing while on Accutane. My skin is very, very soft, which that I'm not against. So the other product I use is by Clarins. It's called Multi-Active Night, and it's extremely hydrating. I love this night cream. I had previously used it before Accutane, but it was a little too thick because my skin was a little bit more oily. But now that I do have dry skin from the Accutane, I highly, highly recommend the Multi-Active Night from Clarins. In addition, I have been trying to combat the acne scarring that I already have during the process of Accutane, so when I get off, I hope to have really nice even skin. So I've been using the Perricone Pigment Corrector, which I think is really working. I have a lot of acne scarring on my cheeks that I cover with foundation and powder, but I've been noticing a big difference. This is a very expensive product. It's $95. So it's only if you have really intense acne scarring that bothers you, but that would be my recommendation for that. I think that's everything. I haven't found a body moisturizer that I'm crazy about yet. I need to try the CeraVe one that was recommended to me by my doctor. I have been using a hydrocortisone cream on the spots that are itchy and red and, like the mild eczema spots. So that's been helping a little bit, but that's something that you just have to deal with. I don't know if you guys can tell any difference in my skin. I feel like it looks a lot more dewy, and which I really like. It doesn't really look that dry. A lot of people, when you look at their Accutane videos, especially towards the end, they just have this gorgeous glow, and I feel like I'm getting that little by little. Let me know if you guys have noticed that. I just tend to see that, and everyone that I know that's been on Accutane has that kind of beautiful skin glow, and that's really what I'm going for. So I hope you guys have enjoyed this video. If you are on Accutane, I hope that you learned a little bit about some products that you can use, and if you're not, you learned a little bit about the drug. I just want to let you guys know that I'm on it. So if you guys have any questions, please comment below, and thanks for watching. I'll catch you guys next time. Bye.